Arch height from the medial view is one of the features used to classify foot type as either normal or neutral, pronated, or supinated. From the medial view, this foot will present with a normal medial longitudinal arch height, with equal talar head palpation both medially and laterally. From the medial view, the foot may present with a lower medial longitudinal arch, with the talar head palpable more medially than laterally. From the medial view, the foot may present with a higher medial longitudinal arch, with the talar head palpable more laterally than medially. For daily education and training, follow us on social media, including Facebook and Instagram. Subscribe to our YouTube channel, follow us on LinkedIn, or visit dolaorthotics.com.